So my name's André McDonald. I'm a postdoctoral fellow at the Peter Boris Centre for Addictions Research and the Michael G. DeGroote Centre for Medicinal Cannabis Research at McMaster University. So I guess my primary interest in cannabis research stems from the recent legalization of cannabis in Canada. Um, Really, there was an absence of evidence on the risks associated with cannabis use, specifically the mental health risks. And that's been an area of interest for me, um, specifically in youth. So looking at whether youth cannabis use is causally related with mood, anxiety, and psychotic disorders. Beyond that, I'm also interested in just evaluating cannabis legalization as a policy. So looking at, um, you know, uh, cannabis outcomes, including whether more people are using cannabis, whether they're using more frequently, whether there's adverse consequences associated with cannabis use. And then I'm also looking at other substance outcomes, including alcohol use, tobacco use, opioid use, and whether legalization of cannabis maybe had some substitution effects with those other substances. So recently, I've published some articles looking at youth cannabis use and mood and anxiety psychotic disorders using linked data. So through survey data linked to health service use data. So whether youth who reported using cannabis were more likely to subsequently use health services for those mental health effects. This is a really important question, a public health question, because so many youth are using cannabis. And if it really does, if it's causally related to these outcomes, um, it should be a very high priority, public health priority to reduce and prevent youth cannabis. But right now, the evidence is still unclear. So that's why that research is important. Beyond that, um, evaluating cannabis legalization is important just as to know whether it's an effective policy, so that beyond the continuing response in Canada, for other jurisdictions that are currently undergoing, policy reform. The U.S. is rescheduling cannabis. Germany just legalized. So there's a lot of other jurisdictions that are looking at the Canadian example and trying to know whether this is a good idea and what they can learn from us. So evaluating that is really important for a global health, from a global health perspective.